Hi, I'm Dr. Jeffrey Garofalo. I'm an advanced trained, non-surgical disc specialist and chiropractic veteran of 22 years. What does it mean to be an advanced trained, non-surgical disc specialist? It means that I am a chiropractor, but I have multiple courses and years of extra training in the spinal disc injuries, and how to help them non-surgically. Welcome to my channel. Today's topic is to help all of those who are suffering from spinal disc disease called degenerative disc disease. This is going to be a 3-part video series. Part number 1, how to help you non-surgically. Part number 1 is how to get a proper diagnosis, and that is key. In order for all of you spinal disc injury sufferers, especially those with degenerative disc disease, you must get a proper diagnosis. See, too many patients come to me from long distances. They've been being treated naturally, non-surgically, some medications, some talk surgery, and the primary thing they still don't understand is, what is the problem? So let's talk in this video about ways to help you get healthy non-surgically, and the first way is to get a proper diagnosis. Now, if you have spinal degenerative disc disease, one of the main things you'll need to do is have an x-ray taken of your entire spine. Why? Because the degenerative disease is typically a symptom. That's correct. The degenerative disc isn't the cause. It might be the cause of pain for you, but it's not necessarily the cause of your degenerative disc. And many people say, well, it's because I'm getting older. Well, that's not true, because I've seen many MRIs and many x-rays of older people in their 70s and 80s who don't have degenerative discs. So if it's just a matter of aging, then everybody who's 70 or older would have that in my office, and that's not true. So what is the case if it is a symptom? Typically, degenerative disc disease occurs over time because of misalignment of the spine. And so x-rays are of vital importance from the top of the neck all the way through to your low back and pelvis to look at the alignment of your spine. You see, this thing called the disc is like a water balloon. And when the bones are in alignment, properly positioned, they put proper pressure on the disc where it belongs. When your spine shifts out of alignment, you start putting pressure on the disc where it doesn't belong. And that pressure squeezes on the disc and start pushing nutrients and water out, and it becomes thinner and thinner like a water balloon. So the first thing you must do is have proper x-rays and look at the alignment of the spine from top to bottom. Improper alignment of the spine will lead to degenerative disc disease. The second thing you must do to have a proper diagnosis is have an MRI done. MRI is the gold standard. To see is to know, to not see is to guess, and MRI is the gold standard of disc and disc injuries. The key is this, though. A little known fact is whoever is trying to help you with your degenerative disc must personally read their own MRIs. That means they must put the images up and study their own MRIs, because if not, there is a research article from 2009 Spine Journal that says the radiologist who reads, the general radiologist who's reading the MRI and writing a report, has a 42.2% error rate. Meaning, if you're a chiropractor, you're a neurologist, you're a neurosurgeon, your orthopedic is not looking at the MRI itself and able to diagnose in front of you exactly what's going on, and they are just going to treat you off of a report that is a 42.2% error rate, and you're not getting the proper diagnosis. The next part is you must have a proper hands-on examination while the practitioner is listening to your symptoms. You see, you might have multiple levels of disc injury in the spine on MRI. And each one of those levels could be the cause of your symptoms. But if you don't have a very specific and detailed examination while the practitioner listens to you, you might be treating the wrong disc. Let me give an example. Picture multiple, 5 or 6 little babies in front of us right here. And all of them are crying, except one is crying the loudest. You have to identify that one, and that's the one you pick up and pacify. It's the same thing with your spinal disc injuries. You might have multiple levels of spinal degenerative disc in your neck or low back, but how do you know which is the primary one that is screaming the loudest? Well, that's done with a really detailed history. Your practitioner should ask you specific questions, listening, and then they should be touching your neck or low back and identifying and asking you, is it this level? Is it this level? So they must know their spinal levels and their spinal disc levels by hand and by sight on your neck and low back. They must determine through history of pain level and having you try to identify and then they identify. And we can also, as experts, use your arms and legs, something called dermatomes, because each nerve has a specific disc associated with it. And if that disc is degenerative and affecting the nerve, it will affect a certain part of your arm or a certain part of your legs. And that's another key piece of information that we specialists can utilize in order to determine exactly which level is the problem. So there are 3 parts to helping you non-surgically help your degenerative disc. Part number 1 is X-ray to determine spinal alignment and pressure as a result causing the disc injuries. Number 2, your MRI must be read by a professional in front of you. That professional must read the MRI, because if they just read the report, there's a huge error rate. And lastly, that practitioner must be detailed. They mustn't just tap a reflex, look at an MRI and say, that's the level we're going to work on. They have to identify your history with your symptoms, specific levels on the neck or low back, and also use the arms and legs if possible. So if you hope to help yourself non-surgically through degenerative disc disease, then you must, in part 1, get a proper diagnosis. In part 2, we're going to talk about how to heal it with a really, really benchmark treatment plan that is non-missed. And if your practitioner is not doing this, you must find a new practitioner. I'm Dr. Jeffrey Garofalo of the Midwest Disc Clinic and Legacy Chiropractic in Shipshewana, Indiana. I'm an advanced trained non-surgical spine and disc specialist and chiropractic veteran of 22 years. I'm also the author of that book right there, Never Look Back, A Simple Guide to the Cause and Care for Your Back Pain. If you want more information, check us out on Facebook, Instagram, subscribe to our YouTube channel, find out more information. Have a great day.